Hi everybody, this is Dr. Richard Schulman. COVID-19 is an event. It's far more than a pandemic. It's a traumatic event that's having far-reaching emotional and psychological consequences. I've been reading articles that mental health crisis lines have been ringing off the hook since this thing started. I know my patients are very concerned about it, and in every session I've had, we've talked for a little while about it. COVID-19 is a traumatic event. You know, in the diagnostic manual, when you look up post-traumatic stress disorder, they'll describe the trauma as an event where there's serious injury, or you came close to death, or you witnessed serious injury or a death in someone you care about. COVID-19 is a traumatic event. You may not know anyone who tested positive. I don't. You may not know anyone who really got sick. I don't. But it's a traumatic event because it's a worldwide event where people are dying and it's being hammered into us on a moment-by-moment basis and has affected our behavior. The fear is the trauma. And it may be very reasonable to keep 6 feet away or wear a mask in public or whatever. But it's a trauma. And we don't want to live in a post-COVID-19 world where if somebody coughs, we have a panic attack. So addressing the mental health part of this event is very, very important for our, of course, short-term, but intermediate and long-term futures. So, if you have a therapist, please stay in contact. Reach out, connect, talk about how you feel, talk about what's going on. Very, very healthy. If you don't have one, I'm going to give you a few ideas about how to find one. Now, of course, the most basic thing is ask your friends. Who do they like? Most people are not embarrassed about seeing a therapist anymore. It used to be this very shameful event. Now everybody goes to see one from time to time. Ask who they like. Ask why they like this person. You know, there was research done on what people liked in therapists. 2 factors fell out. One was accurate empathy. Can the therapist accurately identify how you're feeling and feed it back to you? The second is congruence. Is the therapist who they say they are, who they present? And you know, patients can scope this out. They're far more in tune with us as therapists than we want to admit. I actually admit it. I think it's great. When I'm off, they will tell me right away. And I'm fine with that. So what does this mean from a practical point of view? Well, it's one thing, you know, patients are very forgiving. If I say to a patient, you know, you look sad, and I miss, they'll say, no, I'm not sad, I'm angry. And they forgive me for missing. They like it that I try, though. And I've gotten pretty good at accurately identifying how people feel. Congruence is a little different. You know, I'm a very, maybe you don't know, but I'm a very active person. I like to engage people. I like to kind of mix it up. And I never could do that therapy where the therapist was just quiet and waited. To me, this is a relationship. If I talk to somebody, I want them to talk back. I want them to give me feedback. I want to engage. And I didn't think patients wanted to be in a relationship where I just sat on a bump, like a bump on a log. That wasn't going to work for me and not for them either. So congruence for me means being active. And yes, I've learned how to confront people. I've taught many patients how to confront people. It's actually an art form, a skill you can learn. It's quite beautiful, but I'm going to confront. You know, it's like the baseball manager that argues with the umpire. The umpire's not going to change that call, but they might change the next one if they kind of get a little doubt that they missed the call. So I'm always going to make the call. I'm very active in therapy. If that's not your cup of tea, that's fine, but that's where I am. In fact, I have a patient who's a therapist, and she told me the one thing she learned in our therapy was that she could be real with patients. And her therapy improved tremendously. Her clients improved tremendously. I think you got to be real. It's another way of being congruent, I guess. Okay, the therapist also has to say the unsayable. One of my trainers in Palo Alto, Sheldon Starr, said my job was to say SHIT and make it sound like ice cream. Pretty funny line. Then he paused and he said, of course, sometimes, it's just shit. You have to say the unsayable. You have to enter into the patient's world. In fact, one of my other trainers in Palo Alto, Donna Horne, Dr. Donna Horne, brilliant teacher, she confronted me on this. And she was not very shy or resident about it. She told me that I knew the truth. I could smell the truth and taste the truth. She was a little poetic, I could hear the truth and see the truth. But I didn't open my mouth, so I was fucking worthless. It sounds funny now, but it hit me like a baseball bat. Of course, it gave me great freedom to confront her and say, well, I can run the whole unit without you. And she did, and it was one of the most amazing experiences of my young career. I guess that's what she wanted. She spoke the truth. The therapist has to be unafraid to say the unsayable and speak truth. Maybe they find a way that doesn't knock you over the head like Dr. Horne did with me. I thank her forever for it, by the way. But they have to capture how you see the universe. You might not get this all on the first meeting, but they have to resonate with your view of the world, and you feel comfortable speaking with them. One more piece: compassion. My old friend Brian Hill, the astrologer, when I first met him, he asked me what I wanted to know from the chart. I said, how come so much pain? He said, I don't need a chart to tell me that. Look at what you do for a living. Without compassion, you're nothing. And you do have a lot of compassion. So what's compassion? I think it's three things. Kindness. Well, that kind of goes without saying. Empathy. There we are, back to that accurate empathy thing. And action. No action, no real compassion. In the therapy session, if I'm going to be useful, I have to find the way to confront what is bothering the person that comes to me. I cannot let it go. I can't do professional hand-holding. Right now, people need support. They need a chance to express their feelings, express their fears in a supportive environment. Information is scarce right now about the physical parts of this, but not about the emotional. The emotional is trauma release, trauma treatment, and it's an ongoing trauma. We'll need to reconnect with this again and again and again, because the disruption in our lives reminds us that we're living in a trauma. You can't go out, you're reminded you're in a trauma. You can't see a ball game, you're reminded that you're in a trauma. You turn on the news, you're really reminded. So I ask that people reach out to your therapists. At some point your family's going to get tired and your friends are going to get tired of hearing that you're upset. Therapists are trained with how to do this. So reach out, express yourself, check in with your loved ones, stay cool, stay healthy. I love you. Peace out.